In this lesson, we're going to discuss how to handle patient referrals and process patient admissions. To manage your patients, you need to access the patient list. To access the patient list, there are two different methods of being able to do that. The first method is by clicking on File and then clicking on Patients. This will bring up your patient list. The second method of being able to access the patient list is by using the icon on the healthcare assistant toolbar. The fourth icon to the left is the patient list icon. If you click on that, it'll open up your patient list as well. There are two views to the patient list. The first one is called Classic View. Classic View is given that name because it closely resembles the patient list of previous versions of the healthcare assistant. The patient list in Classic View has the list of the patients on the left side, and on the right side contains a demographic sheet about the patient. Some information that shows up here is the patient's address and phone number, any kind of claim balances should the patient have one, who referred the patient to the agency, any kind of medical alerts or remarks. It also contains admission information such as who the case administrator is and what the patient's current status is at this moment. It also shows the patient's admit and discharge date with the number of admissions. Lastly, it shows the patient's policy number and who their primary insurance is. To toggle to the second view of the patient list, you're going to click on the button here that says List View. When you click on List View, it removes the demographic sheet and it gives you the patients in a list format where you're able to scroll both up and down and left and right to view patient information. Regardless of which view you're in, whether it be the Classic View or the List View, the patient list allows you to apply several different types of filters to be able to sort the patient list to your liking. The first method is by sorting the patients based on their current status, which appears up here on the top part of the patient list. The healthcare assistant color codes your patients based on their current status as they are undergoing care within your agency. Patients that are currently admitted show up as green. Patients that are transferred or on hold show up in red. Any patients that are either discharged or non-admits, they show up as gray. And for patients that are still undergoing evaluation and haven't started care yet, show up in purple. For example, if you would like to see all of your discharged and non-admit patients removed from this list, simply uncheck those boxes, and what will happen is that the patient list will automatically remove them. You can also filter out patients based on certain demographic information that they may have. For example, if you want to filter out a patient based on city, go ahead and click on the drop-down menu on the upper left that says Select Filter. Choose City, and the cursor will be automatically put into that field. Once you start typing, it'll automatically filter that list for you and will bring you up to patients that meet that particular criteria. You could print out the patient list as it is shown, even with filters, by simply clicking the Print List button on the bottom of the patient list. The report that will appear looks something like this, where it will show the patient's number, name, social security, address, phone number, telephone, and their current status, as well as their SOC date.